Hello, everyone. Welcome again to Toolkit Talks, Racial Justice Competency Model, or RJCM, Implementation Toolkit for Public Health. My name is Jennifer Smith with the Office of Public Health Practice Planning and Local Partnerships at CDPHE, along with CoCares, the Colorado Alliance for Resilient and Equitable Systems, serving the healthcare and public health workforce. This is video 2 of the Racial Justice Competency Model Toolkit for Public Health from the Public Health Training Center Network, the National Network of Public Health Institute, and the National Coordinating Center for Public Health Training. Thank you for joining us today. So here's our video topic list. Hopefully you got to watch our first video, which was the introduction to the Racial Justice Competency Model and overview of racial justice competencies. Today is video 2. We're going to go into what is racial justice. Then our next video 3 is when to use the RJCM. Video 4 will be how to use the RJCM. And video 5 will be surveys and self-assessments. And then video 6 will be assessing the impact and next steps. So the Racial Justice Competency Model, the Public Health Training Center Network acknowledges that this is just a starting point for organizations focused on increasing their workforce capacity to address racial justice in their work. The RJCM Toolkit is intended to serve as a point of reference to begin with, and it will continue to be reviewed, refined, and revised. So what is health equity? The definition of health equity from the World Health Organization says that equity is the absence of unfair, avoidable, or remediable differences among groups of people, whether those groups are defined socially, economically, demographically, or geographically, or by other dimensions of inequality. For example, sex, gender, ethnicity, disability, or sexual orientation. Health is a fundamental right. Health equity is achieved when everyone can attain their full potential for health and well-being. So then what is racial justice? According to raceforward.org, racial justice is a vision and transformation of society to eliminate racial hierarchies and advance collective liberation, where Black, Indigenous, Latinx, Asian Americans, Native Hawaiians, and Pacific Islanders in particular have the dignity, resources, power, and self-determination to fully thrive. Here's a quote. Structural racism in the United States has been impacting health outcomes and for people of color and tribes for generations. It is time for public health professionals to be bold leaders and take purposeful action to introduce workforce development practices that promote racial justice. We can no longer claim that racism is a problem of the past. We must work to create equity-centered solutions to stop perpetuating additional harm in the communities most impacted by racism. It is imperative for state and local health departments to understand their role in combating racial injustice. This is from Moving from Conversation to Action, Developing a Racial Justice Competency Model for Public Health Professionals by the Public Health Learning Network. What is racial equity? Racial equity is a process of eliminating racial disparities and improving outcomes for everyone. It is the intentional and continual practice of changing policies, practices, systems, and structures by prioritizing measurable change in the lives of people of color. Distinction between racial equity and racial justice. Racial equity is the process for moving towards the vision of racial justice. Racial equity seeks measurable milestones and outcomes that can be achieved on the road to racial justice. Racial equity is necessary, but not sufficient for racial justice. So here we're going to go over just a little bit of terminology. As we showed in the first video when we were going over the racial justice competencies, that same presentation includes the list of terminology that they have included. I am not going over that entire list. It is very, very extensive. So I would recommend, again, that you take that out and review that as some terminology. Some of the terminology deals with racial justice and racial equity. Some of it just involves equity in general and all the different kind of ways people can be discriminated against and biased. So I definitely would recommend taking a look at that as you go through this module, because it's way more extensive than what I'm going to go into. But I'm just going over very briefly a few of the terms that they've included. So first we have colonization. Colonization can be defined as some form of invasion, dispossession, and subjugation of a people. And again, you can see this pictures of the Native Americans in what is now the United States, when the colonists came over and took over their territories. Colorism, using white skin color as the standard. Colorism is the allocation of privilege and favor to lighter skin colors and disadvantage to darker skin colors. Colorism operates both within and across racial and ethnic groups. Discrimination, the unequal treatment of members of various groups based on race, gender, social class, sexual orientation, physical ability, religion, and other categories. Dominant culture refers to organizational culture that is heavily influenced by the leadership, management, and organizational development as defined by white men and women. Implicit bias, or as we talk, it's unconscious bias that you are unaware of. Negative associations that people unknowingly hold. They are expressed automatically and without conscious awareness. So these are things people are not aware of consciously. And they can be good biases and they could be bad biases. Indigeneity. Indigenous populations are composed of the existing descendants of the peoples who inhabited the present territory of a country at the time when persons of a different culture or ethnic origin arrived there from other parts of the world, overcame them, and by conquest, settlement, or other means, reduced them to a non-dominant or colonial condition. Intersectionality. Intersectionality is how race, class, gender, and other individual characteristics intersect with one another and overlap. It is the acknowledgement that everyone has their own unique experiences of discrimination and oppression, and we must consider everything and anything that can marginalize people. Gender, race, class, sexual orientation, physical ability, and many more. Marginalization, social process by which individuals or groups are, intentionally or unintentionally, distanced from access to power and resources and constructed as insignificant, peripheral, or less valuable, privileged to a community or mainstream society. Oppression, systemic devaluing, undermining, marginalizing, and disadvantaging of certain social identities in contrast to the privileged norm, when some people are denied something of value while others have ready access. Tokenism, covert racism, gives those in power the appearance of being non racist and even champions of diversity because they recruit and use people of color as racialized props. So, again, throughout this section here, it's probably our shortest video that we have because I think we need to do work on the side besides from this video regarding health equity, regarding racial justice, regarding all of the terminology that we discussed. You know, we need to look into that further on our own. And so, what I would recommend, you can use some of the public health training network centers. You know, we have a region here for Colorado, Region 8. Look at some of their resources that they have available regarding health equity, racism, you know, social determinants of health, anything that kind of goes into what we're discussing here in this racial justice model. Do the trainings, do the videos, get out there and learn, talk about this terminology because I don't know if like me, when I was reading these out loud to you, all the different terms and all the different words that we talked about, as I'm saying them out loud, they sound really horrible, as I'm reading that aloud and how, um, how horrible some of this is, right? When we're marginalizing groups, when we're talking about oppression. So talk about them, get these out here, get used to saying these terms, learn these terms, talk with your teams about them, talk about different people in the organization about these different topics, go into these distinctions of what is racial equity, right? What is racism? What is racial justice? Start talking about these, make them common knowledge, make them something that you hear and are not afraid to talk about. I think that's one of the biggest things is just getting used to talking about these things and being open and honest with them. If you are a white male or female, understand, what benefits that's given you versus someone else in your team that may not have had the same um, growing up as you did, right? The same privilege. So I think this just opens up a conversation that can last longer than this video, and keep learning and talking about it. So I think that would be my next statement. So you can see here, this slide just talks about the Public Health Training Centers network. I think most of us use them a lot in our work. They have such great training, and most of it is free for public health workers, which is amazing. So please look at their information. We'll have all this posted, of course, in our description here on the YouTube channel and on the CoCares website. But they have so many wonderful resources and things that we can use to support this effort of racial justice. So please take a look at them and support them. They do a lot of great things, a lot of great funding. And then the next steps really for you would be to keep learning. I'll put this up probably at every video. This is a lifelong process and we're going to work at different paces. We're going to be at different paces already when we start this journey, but just keep working towards it, and you will get there, and you'll make a difference. And also, please visit their website to give feedback on this toolkit, on the information in it, and just how you're using it, and if you find it useful or not, because they're just trying to improve this great toolkit for us. So I think it's a great idea. So our next video is going to be on when to use the racial justice competency model. So we'll have a lot of good information on that, but keep on working on your own. Keep looking at different resources and training that can extend this knowledge and really make this toolkit even more than it already is. So thank you so much for watching and take care.